Morning, everyone. A warm welcome back to Dare to Care. For those who have joined us for the past 2 days, welcome back. This is the third day of our virtual experience. Throughout the 2 weeks, you will get the opportunity to participate and interact with our scholar ambassadors, scholarship officers, university partners, and professional reps from the various public healthcare institutions. Do note we have an ongoing leaderboard and contest section for participants to win attractive prizes. We have one contest closing at 12 p.m. today. For today's session, we have faculty, admission officers, and healthcare scholars from the Singapore Institute of Technology with us. Do use the Q&A function to ask questions and remember to upvote the questions for those you want answered. We will try to answer all the questions, so do upvote them if you want the answers to be the questions to be answered. Now, without further delay, can I invite Professor Alan Wong to give us the opening introduction? Professor Wong is the Cluster Director, Health and Social Sciences at SIT. Professor Wong, please.
Thank you, Elijah. Good morning, warm greetings from the Singapore Institute of Technology, Health and Social Sciences. The Singapore Institute of Technology, or SIT, is turning 12 years old this year. This is our 7th year as an autonomous university. As a University of Applied Sciences, we have been running health sciences programs since 2011. Our pre-registration health professions program started in 2016, and today we offer programs in physiotherapy, occupational therapy, speech and language therapy, radiography, and dietetics. We also offer a post-registration program in nursing for those who are registered nurses with diplomas in nursing from Nanyang and Ngee Polytechnics. There's never been a better time to join the healthcare sector. We are currently living in the midst of a pandemic. The World Health Organization declared the COVID-19 outbreak a pandemic on 11 March 2020. So we are almost 1 year into it. Singapore has seen spikes of cases over the past year, but these are now mainly controlled. And we now have vaccines against COVID-19, but whether we can achieve herd immunity awaits to be seen. Many countries, including ours, are now busy working on immunizing the populations. Health professions we call allied health have been making important contributions to healthcare for a long time. For example, radiographers have been instrumental in providing timely medical images that allow doctors to make diagnosis and timely decision on treatment. They are important people to alert the diagnosis of pneumonia in people with COVID-19 infection. Physiotherapists, occupational therapists, and speech and language therapists are pivotal in the care of patients with chronic diseases. They provide rehabilitation for people after acute diseases, injuries, or surgical procedures, and even for people who recover from COVID-19. You may have seen in the news about the Bangladeshi worker who spent nearly 5 months in the hospital, including 2 months in the intensive care unit and 5 weeks of intensive rehabilitation. And finally, dietitians provide medical nutritional therapy, and they make significant contributions in advising the populations on healthy eating. Healthcare professionals such as these and doctors and nurses are recognized by Singaporeans and our government. Recently, our Deputy Prime Minister announced that public healthcare workers would be getting a raise in their salaries. Being a healthcare professional is not a walk in the park. There are many challenges in healthcare, and some of you may find wearing a mask for an hour tedious and undesirable, but imagine wearing it for 8 to 10 hours a day in your job. But the most meaningful part about being a health professional is making an impact on the lives of patients, helping them restore their health and independence, and getting them out of the hospital beds and back to their homes with their loved ones. I hope you will find your calling to be a health professional, because indeed there's never been a better time to be in healthcare sector and find fulfillment in a career as a healthcare professional. This morning, we are grateful to MOHH for allowing us to share with you about the health sciences programs offered by our university. You will see how our campus, teaching and learning spaces and labs look like. You will hear from our students on what it is like on a typical day of learning. and you will experience how we conduct our lesson. Please do not hesitate to ask questions, and we will be happy to address them. I hope you will find the session helpful. Thank you.
Thank you, Prof. Fong, for the opening. For our next speaker, Associate Professor Tan Bing Lead will be giving us a Health and Social Sciences program talk. Prof. Tan is the Director of Programs, Health and Social Sciences Cluster. Prof. Tan, please.
Hello, good morning. It is still the Chinese New Year period, so I think everybody is still in the festive mood. And for those of you who have just received your A-level results, I'm sure you are now thinking about what is the career path you would like to take. Some of you may have a IB, some of you NUS High, and some of you have a Polytechnic diploma. So it's now actually at the crossroads of your life whereby you will decide what kind of a degree do you wish to pursue, which may determine your career in the first few years. And for health sciences, you will realize that a lot of people who pursue health sciences degree, they make it their lifetime profession, and you will see why. Okay, Prof. Wong just now mentioned about the COVID-19 situation and how healthcare professionals rise to the challenge to contain and manage this disease, this virus. And at the same time, I'm sure you have also heard about a lot of work, dedication, sacrifices that healthcare workers have to make. I'm sure you have been touched by them. And I think all of us here at SIT Health and Social Sciences faculty, we are very proud of being a healthcare professional because we think we can actually contribute to the society, to our family, to the family and friends to keep people safe, to keep people healthy. I think beyond also COVID-19, there is also a realization that healthcare professionals have a huge impact on chronic diseases, chronic illnesses. As you are aware, a lot of chronic illnesses such as diabetes, chronic heart conditions, stroke, they are actually affecting a large proportion of the Singapore population. And several of these chronic illnesses have a huge disability burden. And allied health professionals are actually the ideal profession to work with people with these conditions. And this is why when we first launched our allied health degrees in 2016, we had a very, very huge uptake. And there is also, of course, the projection that more allied health professionals will be needed in the next few years. Okay, as I said, there are a lot of people vying for places in our health sciences courses. Later on, I'll talk more about these programs as well as our selection criteria. But I think what we want to see is that people who are interested in being a healthcare professional to take a leap of faith to go into this profession. Okay. I said just now that we launched our health sciences, our allied health degrees in 2016. And our first 4 allied health programs are physiotherapy, occupational therapy, diagnostic radiography, and radiation therapy. And in 2016, we launched the dietetics and nutrition program. And in 2020, last year, we launched the speech and language therapy program. We also have a post-registration nursing program, as Prof. Wong has mentioned just now. Okay, so for last year, we actually have more than 3,000 first choice applications, and about 1,000 or so are shortlisted. And in the end, we offered about more than 600 places to our students. So as you can see here, our programs are highly competitive. But we hope that people who are interested in this profession will still try and go for it, because later on we'll talk more about these programs as well as our admissions criteria. But these are our programs again in a snapshot. I will start with physiotherapy. I think most of you will have heard of the physiotherapy profession, but just to give an overview, physiotherapists restore normal human movements. And many of you may be familiar with the profession of physiotherapy in the area of sports sciences. But physiotherapists actually work in a variety of clinical settings and with different specialties and with different patient population, from the very young, the neonates, to the very old, the geriatrics, the older adults. So it's not just with sportsmen, but we need a lot of physiotherapists given the aging population. So besides sports rehab center, physiotherapists has a huge role to play in acute hospitals. Physiotherapists works in ICU, in high dependency wards, in acute wards to help people with severe medical conditions to get back on their feet again. A lot of physiotherapists are now also working in community settings, community hospitals, day rehabilitation centers, in nursing homes. We also have physiotherapists working in special schools and also other outreach services, as well as private practices. So as you can see here, the role of physiotherapists has actually extended to emergency services. So we have actually physiotherapists working in the e-room and also in tele-rehab. Now with COVID-19, physiotherapists have actually moved their services through online help. This is to allow older adults with people who are unable to actually travel to the rehab facilities to still receive their therapy. So this is one of the innovation that the profession has made. So as to how physiotherapy classes are conducted, we use a variety of teaching methods. There are lectures, there are labs, and there's a use of equipment. We also have hydrotherapy sessions, and of course, using very authentic learning and experiential learning to teach physiotherapy students, because it's a very hands-on program. Okay, so now I move on to occupational therapy. Occupational therapy is a client-centered health profession concerned with promoting health and well-being through occupation. A lot of you may be wondering, what's the difference between physiotherapy and occupational therapy? Just now you can see that physiotherapists, they help to restore human movement. For occupational therapies, they are more concerned with promoting health and well-being through activities. So looking at what are the things that people do in their everyday life. So for example, for babies, for children, the things that they are important to them are play. For school-going children, the things that are important to them are studies. For adults, it can be homemaking, it can be work. For older adults, it can be activities of daily living and leisure. So occupational therapists help people to overcome difficulties in performing their daily occupations or daily activities after being affected by different health conditions. Okay, it can be autism and other developmental problems, fractures, mental health issues, stroke, falls, or dementia. So occupational therapists work with a huge variety of population of people. So occupational therapists help to fit the person. It's just not looking at the person's medical condition or disability, but also looking at what are the things that are meaningful for this person and what are the environmental barriers or facilitators. And through looking at the person's factors, whether or not he's able to perform his daily activities, even with one-sided weakness, coupled with the environment that he or she is, and with the activity, we try to maximize the best fit. Okay, so like physiotherapists, occupational therapists also work in a variety of settings, okay, from physical rehab to pediatric to mental health, as well as older adult setting. Okay, occupational therapists have been receiving increasing attention in the media. So we have occupational therapists who have actually specialized in low vision, in driving rehabilitation, and even using pet-assisted therapy. We also have occupational therapies in the area of mental health, working with children, and also really going into dementia care. Our occupational therapy students have also been the spotlight. Occupational therapy program is very exciting. They get to learn from people who are in the community with disabilities, and they also engage in a lot of service learning initiatives. Okay, next I move into speech and language therapy. This is our newest program. So speech and language therapies help infants, children, adults, and the elderly who have difficulties with swallowing, feeding, the speech, both in terms of articulation as well as pronunciation, language, people with difficulty in fluency, in stuttering, as well as to work on voice. So some of you may really enjoy languages. Some of you are very good in the expressive language. So this is an area that you may be interested in. The speech and language therapies also work very closely with the medical team to carry out investigations for diagnosis. So there are investigation techniques such as video fluoroscopy, as well as endoscopic evaluation to help to assess and diagnose the different conditions and to enable proper treatment to be conducted for swallowing difficulties. Okay, so SLTs can work in hospitals. A lot of speech and language therapies are really needed for people who have suffered from conditions such as stroke, because people with stroke, they may be unable to receive information, language information, or they may lose the ability to express language. Some of them will have swallowing difficulties. So speech and language therapies are crucial in hospitals. And other than that, they are also very important in early intervention centers in preschools, particularly to help those with speech and language development delays. Besides that, speech and language therapies are also in demand in nursing homes, elderly daycare centers, and of course in mainstream schools. And speech and language therapies do also go into teaching and research, as well as communications and consultancy. So there is a huge scope for people who are trained in this area. Okay, so this is a newspaper clip of how somebody's life has really improved through the use of speech and language therapy sessions. And this is somebody with a severe cerebral palsy. So a child with a long-term condition, how to enable him to have a better quality of life in terms of communication, in terms of being able to live in a meaningful way. It's something that speech and language therapies will have a huge impact in. So in this case, the speech and language therapies has actually devised a communication tool to help this child here with a cerebral palsy to be able to continue to engage with people. Okay, next I'll move on to dietetics and nutrition. Okay, dietitians, they apply scientific knowledge of human nutrition to maintain and promote the health of individuals and the community. They also manage and treat medical conditions and are consultants on all aspects of nutrition care within the medical setting, as well as the food industry and the media. So dietitians are different from nutritionists in the sense that they are certified to work in a clinical setting, because our program enables our dietetics graduates to be equipped with clinical knowledge. Therefore, they can actually treat patients in hospitals, unlike nutritionists who cannot. Therefore, dietitians can work in acute hospitals, community hospitals, private clinics, nursing homes. They can also work in areas that nutritionists work in, such as food services and in public health, in research and teaching. And they can also work in nutrition consultancy, such as sports performance centers. Okay, so a trained dietitian will be able to have the knowledge about the nutrition requirement throughout the lifespan, okay, from pregnancy to childhood to adult stage, as well as older adult stage. So dietitians do work with, again, all age groups. Okay, and dietitians will then perform medical nutrition therapy to work with a huge variety of conditions, such as diabetes, heart disease, people with kidney issues, people on weight management program. And that's where they work very closely with the medical team to prescribe the appropriate diet for someone who is post-surgery, for someone who's on the nasogastric tube feeding, for someone who needs to manage his or her weight. So all these are actually prescribed by dietitians. So there are many other areas that dietitians may work in. They will work in eating disorders unit. They are a very crucial member of the multidisciplinary team. They also work with people in the cancer wards. They work with people with dementia as well in terms of the dietary requirements, people with osteoporosis, cystic fibrosis, people who have undergone a transplantation, etc. So there are a lot of areas for specialization for somebody who is equipped with a dietitian degree. And this is a snapshot of a recent research study that has been conducted by the chief dietitian from NUH. So actually Sulin came up with an app, a tool to help people with diabetes to monitor their dietary intake. So this is something that they've launched and is published in a scientific journal. So dietitians are also equipped with clinical and research knowledge to be able to continue to be innovative in their treatment. Okay, so if you do take up the dietetics program, you will be working in a variety of settings. You will be in the kitchen, you will be in food services, you will also be in the acute wards. Okay, so I'm moving on now to diagnostic radiography. Diagnostic radiographers, they are really investigators. They use technology to actually investigate the anatomical region to provide the medical team with a proper diagnosis. So if you are really into the use of technology, you love physics, so this is the right program for you. Diagnostic radiographers, they work in hospitals, specialist centers, polyclinics, as well as private clinics. There is a huge demand for diagnostic radiographers, particularly I think last year when COVID-19 first hit, radiographers are really in huge demand. And we did actually graduate our students early so that they can contribute to the healthcare sectors in the early phase of COVID-19. The diagnostic radiography program is a very hands-on program. We conduct our classes both on campus as well as in the healthcare institutions so that students have hands-on experience working with the machines, with x-rays, CT scans, MRI, ultrasound, etc. And that is why students who wish to become radiographer will come into our program, because we are very closely linked to the healthcare institutions. And therefore, we actually ensure that our program equips students with the right skills and the knowledge to practice in the healthcare setting. Okay, so at this juncture, I would like to play a video on how applied learning at SIT Health and Social Sciences are carried out, because like I say, the health sciences program are hands-on program. So if you do come into this program, your learning will not just be within the classroom, but through a variety of different methods. Okay, I hope it gives you an idea about the different types of learning that you will be exposed to when you join the program. You will have seen from the video that there's a clinical practice education component. So these are compulsory clinical placements in a variety of settings in hospitals, in the community, that every student of the allied health programs have to undergo. Okay. So as you could see from the video, students from the different allied health programs, they do a lot of hands-on, plus also academic work. There are a few modules that are called common modules that people from different allied health programs will actually come together to learn together, and therefore this fosters interprofessional understanding. So right from year one, modules such as health systems, anatomy and physiology, which you have a taste later on, psychology and sociology, as well as research. These are all conducted cross-disciplinary. Therefore, students from physiotherapy will work with students from diagnostic radiography, and students from the dietetics program will work with students from the occupational therapy program. Okay, so likewise in year 2 as well as year 4, the students will also do so. In year 3, students will embark on the honors thesis module, which is like a research project. And some of these projects may also be interdisciplinary in nature. Okay, so therefore, when you join one particular allied health program, you are also expected to work with students from the other programs. Okay, Dara is going to talk more about anatomy and physiology later. So this is one of the foundation sciences in year 1. And students not only learn about anatomy and physiology on our campus, they also use anatomy hall, which is based at NUS, to understand this subject in more detail, because that's where you work with silent mentors, okay, who are actually people who have graciously really donated their bodies upon passing on. So to enable us to learn about the anatomical features. So this will be elaborated later on. Right now, there's a COVID-19, and therefore we have actually halted our overseas exposure program. So pre-COVID, students get to be exposed to the overseas healthcare practices through field trips. So we have brought students to Hong Kong, Japan, Thailand, China, Ireland before. Right now, with the COVID situation, virtual exchanges are in place. And hopefully when the COVID situation goes away next time, we are able to resume this again. But we still have connections with various universities as well as healthcare institutions in the region. So just now I mentioned about the honors thesis. All students not only need to be equipped with the basic foundational modules, knowledge, plus their clinical knowledge, they also have to learn about research in order to be equipped with the skills and the ability to find out what are the latest updates in their own respective profession. So we are not only teaching our students to be great in being an entry-level healthcare professionals, we are equipping students with the right attitude to know that healthcare knowledge is evolving. There is a need to be critical to what's out there, to really learn about what is evolving, to be updated to current practices, so as to be able to benefit our patients better. So in our program, all students have to go through an honors thesis. They have to learn about basic research and be equipped with the skills to do so. So upon graduation, allied health professionals, healthcare professionals have gone into different fields. So besides clinical services, a small number of them also go into administration. A lot of healthcare administrative leaders come from the allied health background. There are, of course, also healthcare professionals who have gone into education, not only in universities, but also in the education offices within the hospitals, but of course, as well as research officers within the hospitals besides the university. Allied health professions can also continue to upgrade themselves through continuing education and additional qualifications. So we have healthcare professionals who have gone on to do their masters, their PhDs, as well as postdoctorate. Okay. So when a healthcare professional, or rather an allied health professional, first start work, they will start as a conditional registered allied health professionals, and they'll slowly move up the seniority level. At the very senior level, there is a career path awaiting, either in terms of being a clinical specialist to specialize in one area, or to go into management, or to go into education or research. Okay. All right, so in terms of admissions to our health sciences programs, for those with A levels, you will need a good pass in 2 of the H2 subjects. So these are the science subjects. And for dietetics, you will need to have a good pass in chemistry. Okay, for occupational therapies, you need a good pass in 2 H2 subjects, but one of which can be science and the other one can be non-science. For those with a diploma, there is actually a website for you to go into to find out what are the relevant diplomas for the respective allied health sciences programs. And you also get some information about the indicative CGPA on our website. All students also need to undergo a medical examination because we are going into the healthcare sector. So there is mandatory medical clearance, and there are also specific things that you need to know with regards to special medical conditions. And students who are shortlisted will then be invited to go for multiple mini interview. So these are the different stations to assess you on whether or not you have the right attribute to be a healthcare student. And the assessors are both from SIT as well as from the healthcare sector. So in other words, we are looking for students and graduates who are caring, compassionate, people-focused, and empathetic. Okay, at the same time, we also need our students to have the right ethics, to be resilient, and also to be inquiring. Okay, with that, I end my presentation. Let me stop share. Thank you very much.
Thank you, Prof. Tan, for giving us a breakdown of the programs. It also makes me want to go back to school again. For our next segment, we'll be having our own healthcare scholars from SIT share with us a day in SIT, my experience as a student. Celine Lee is from the physiotherapy program, while Li Su-Hui is from the occupational therapy program. Celine and Su-Hui, you may proceed to do your introduction.
Oh, okay. Hold on, just let me share screen. Okay, so good morning, everyone. So I'm Celine, and today I'll be sharing about physiotherapy. So I'm year 2 studying at the Singapore Institute of Technology. So what is physiotherapy? So this is a definition that I got from the Allied Health Professions Council. And it says physiotherapy involves the assessment, treatment, rehabilitation, and prevention of pain and injury and other physical dysfunctions. Okay, so what are the 3 main areas of physiotherapy? So the first one is musculoskeletal, which I think many people are more familiar with what physiotherapists do. We treat issues relating to the bones, joints, and muscles. So you can see here there's exercises being done, and we we can treat patients such as those who have osteoarthritis, as well as those who may require rehab for surgery, such as ACL rehab. Yeah. And the next area of physiotherapy is cardiopulmonary, which is relating to the heart and lungs. So we treat patients who have issues relating to their heart diseases as well as lungs. So as you can see on the bottom right, there's a physiotherapist using an instrument to administer breathing exercises for the patient. So some of you may be quite shocked to hear this, but because as physiotherapists, anything that involves a muscle, we are involved in it. So the heart is also a muscle, and the diaphragm is also a muscle. So which is why we are we also train this aspect of our patients. And lastly, we have neurological physiotherapy, and so this is where we treat patients who have stroke as well as a cerebral palsy, or even those who have Parkinson's disease. Yeah. Okay. Sorry. Okay. So why choose physiotherapy? So I'd like to share with you my visions of why I chose physiotherapy. So first is because I actually like to exercise. So because of that, I found this passion in myself, and I was thinking if I like to exercise, and I'd like to encourage others to put in effort into maintaining their physical body as well. So I think this was where I found that if I had a passion in exercise, I could maintain my health. I would like to pass that on to my patients as well. So I also wanted a more upbeat and fast-paced job, which was I think what healthcare could provide me, because I didn't want a desk-bound job as well. Yeah, and I like to act on the spot and be on the get-go, that kind of situation. Yeah, and I think that no day is the same for for physiotherapists, as every patient is different, and there's a lot of learning opportunities in physiotherapy. As you can see, just now I introduced the 3 main areas of physiotherapy. So there's many disciplines and a lot of things to learn as well. So I actually came into physiotherapy wanting to pursue neuro rehab and help patients with neurological conditions. So let me share with you about student life at SIT. So so this is a picture of the Concordia camp, which is a health sciences camp, because in SIT we have a few health science courses. So we have our own camp where we get to interact with each other and get to know more about each other. Yeah, and it's quite fun. And then I also joined the SIT canoeing team, and sometimes you can go for site visits as well to the care homes during our modules. Yeah. Okay, so now to share with you about lessons. So we have our lectures. Sadly, you may not see the lecture theatre right now because of COVID. But yeah, so this was pictures taken at the anatomy lab at NUS. So we actually go over to NUS for our lessons to learn about anatomy. So lastly, I share with you that actually this physiotherapy course is quite content heavy, and you have to be ready to put in the effort and time to study for the course as well. Yeah. Okay. So now I share you about my favorite part about school, which is practicals, because I do enjoy the hands-on learning. So this picture of my knee being cupped, it looks like the Chinese cupping therapy thing, but it's actually what it does is actually sends a current through the knee, so that it helps to relieve pain by providing a sensation. Okay, then this is a Biodex machine, which can help to check the strength of your muscles by doing various tests on your knees. I mean on your based on the joint. Okay, so we do learn how to use walking aids, so you can teach our patients how to use it. And we also have a lot of fun doing exercise creation as well. So we have to think about what kind of equipment that we want to use to help our patients depending on their needs. And yeah, let's show you about so we're doing this, what happened during our musculoskeletal practicals. So I can show you this video. And you can see my arm, right? When they use the band to pull it, right, it can actually go up higher. So I didn't actually put in more effort to raise my arm, but somehow it managed to reach higher. So this is how we can give therapy to our treatments as well, to our patients as well. Yeah. So it's quite interesting to explore that. Okay, so now I'd share about university culture. So this is my personal opinion, and yeah, okay, so I feel there's quite a lot of diversity in SIT, because we are more of a hands-on university, and with aptitude-based admission. So in a way that the students that are accepted are not just based on academic grades, and there are many people who comes from different walks of life, and they end up in SIT, and that it's more I find a more diverse kind of culture. Yeah. It's also I find it quite homely, because the school is quite small, but there's also quite a few amenities to just for students to really stress. As you can see on the right, we're playing the machine. Yeah, okay. Yeah, I feel it's quite good student support with the yeah, because whenever I need some help or anything, you can just easily email the SIT office, and they're always very willing to help now. Yeah. Okay. Thank you. Okay, now I'll pass my time on to Shu Hui. Yes. Yeah.
Hello everyone, my name is Shu Hui and I'm a Year 2 Occupational Therapy student at the Singapore Institute of Technology. So I think this quote very nicely sums up some of the reasons why I chose occupational therapy. And the quote is from Virginia Stoffel, who is the ex-president of the American Occupational Therapy Association. So the quote says, occupational therapy practitioners ask what matters to you and not what is the matter with you. So the meaning of the quote is that OTs help people to go back to their occupations, which is anything that a person finds to be meaningful and important to them, and not just the literal definition of occupation as in your job. Occupational therapists can work with people with mental and or physical disabilities, but no matter what, we always make sure to focus on the person's ability and not just their disability, because we believe in seeing the person as a whole. In terms of the university culture, SIT prides itself on being a university of applied learning. And what that means is that it is very practical heavy. So if you want to apply for any of the healthcare courses, you should expect a lot of practical sessions as well as practical exams and clinical placements. But personally, practicals are my favorite part of school. So I think if you are coming in, don't be afraid, just learn to love them and take it in your stride. I think another part of university culture that I would like to highlight is that you're expected to be adult learners. And what that means is that you need to take responsibility for your own learning by asking for help if you need it. It also means that you should organize your own time and also be punctual, respectful, and considerate towards your fellow colleagues and your professors as well. So now these are just some pictures to highlight some of my favorite parts of school, which, as I mentioned earlier, are practical sessions. So the first picture that you can see on the left is a splinting practical, because OTs make splints to support the hand so that you can still use your hand while it's in a safe position. The second picture is actually from an anatomy practical where we had to mark out the muscles of the forearm that help you to move and enable you to do things like dress yourself and feed yourself. The picture on the right is actually from a gardening practical, because occupational therapists can help people to go back to their leisure activities that they do in their free time, and gardening is one of those activities. So these two pictures are from a module from an assignment that we submitted recently for a module called group interventions. So basically, we are supposed to form a group, and each person in the group needs to teach the other members a new skill. So for our group, two of the skills that we chose were dumpling making and sewing. So we actually got to participate in the activity. So the purpose of this assignment was to allow us to put the theory that we had learned about group dynamics and group facilitation into practice by carrying it out together with our classmates. So that's the end of my presentation. Thank you.
Thank you, Suhui and Celine, for sharing. We have now come to a Q&A segment where you can ask the SIT faculty and the students questions. A basic housekeeping reminder, remember to upvote your questions and also do ask questions that are more applicable towards them. We'll be able to take scholarship questions at our other channels. So the first question, and can SIT faculty answer this one? So the question is, could you share more on the differences between PT, OT in SG and overseas, other than the local ones being recognized by our hospital?
Hello. Hi everyone. Good morning. I'm Tim from Health and Social Science Clusters and teaching the Occupational Therapy degree program. So I'd like to answer the first question. Being a local university, I think the advantage of offering the local degree programs is that we co-develop the curriculums with the industry partners, and the degree programs are tailored to our local context. So it's very relevant in terms of practicals, in terms of the needs from the local industries. Unlike overseas programs, I mean, those recognized university programs are still being recognized by our Ministry of Health. But however, the locally contextualized components is missing. Yeah, so that's the main differences. Yeah, I hope I answered the question.
Thank you, Prof. Tim. Okay, a second question. The differences between RT, radiation therapy, and DR in terms of career prospects.
Oh, well, although I'm not a diagnostic radiographer or radiation therapist, in definition, these two professions are quite different. I think Prof. Tan Ping Lei already mentioned about what DR is about. The radiographers that look into imaging, look into helping the medical team to make a better diagnosis. However, for radiation therapists, I think they are very uniquely looking into cancer treatments for patients with cancers. Yeah, and the type of treatments for in cancer area. Yeah, so it is quite a different career path, I would say. Yeah.
Thank you, Prof. Tim, for answering the question. Okay, shall we go on to a question for the scholars? Perhaps this question is more applicable to the students. Why do you choose to study in SIT compared to other local unis?
Okay, I go first. Okay, so I would think actually because I mean the course that I wanted to pursue is in SIT. Yeah. So I guess that was in a way like I didn't really think much about the uni, like in terms of like, it's more of like the course. So but I mean I had some people I know that they didn't come to SIT because they didn't like feel that it was like recognized kind of school. Then they decided to like just go NUS up, like, yeah. But I think SIT is able to offer this course in a very like more of a hands-on way, which I'm not sure if NUS is able to, which I feel like it's because we are considered the applied university, so I think it's good that our course is in SIT. Yeah.
For me, quite similar to Celine, I knew very clearly that I wanted occupational therapy, so it wasn't really a question of which university. But I think going to the, I remember there was an open house held by SIT, and I went there, I talked to the professors and the students, and I got to know more about what they actually do in the course, and they did highlight that there's a lot of practical sessions as well as clinical placements. So I think those aspects that they highlighted made me feel that I would be prepared for my future career if I join SIT. So that's why I picked this university.
Thank you, Celine and Su Hui. So another question for Prof. Tim. When being an OT, can we choose to specialize in an area? Can we choose which area we want to specialize in? For example, choosing to work in children's setting only.
Okay. As a degree programs, we hope to prepare our students to be ready clinicians as a novice practitioners. I think they need to be a generalist rather than being a specialist. So in the 4 years programs, we teach all students the various aspects of clinical domains in terms of like clinical areas such as mental health, physical rehab, children's pediatrics, or geriatrics, older adult populations. So they need to know all these different aspects in order to graduate. But however, when they join the workforce, they may take several years to develop their special interests, then perhaps go into post-grad studies, masters, and even PhDs to further enhance their knowledge and specialize in certain areas. This is the general trends currently in so-called occupational therapy field. Yeah, I guess this is the same thing applied to all other degree programs as well.
Thank you, Prof. Okay, a question for the scholars and maybe Prof. Tim also. What is the gender ratio for your classes? Is it true that healthcare is a female-dominated industry?
Oh, well, maybe Su Hui, you want to share how many male classmates in your class, in your cohort?
Okay, so for occupational therapy, generally is female dominated. I have 105 classmates, and I think only like 12 or 13 males. So for OT, generally that's the trend, is female dominated.
Yeah, it's always around 10%. Okay. What about physio?
Oh, but I think for physio there are more guys. Yeah, I would say it's I don't really know the exact ratio, but I would say at least, I think it maybe it's just maybe slightly less than half, around there. I would think so. But I think there's actually more females also. But it's not a thrown off like kind of ratio, I guess. Yeah.
I think so far physio has the highest males in terms of percentage across all different programs. Yeah.
Thank you all for sharing. So to our students, I think we live in the 21st century. It's not about male or female. I think males can equally join the PT OT class and females can do the same. So go ahead and join. I don't think that should stop you. Another question is a PT related question. So SIT's PT course used to be jointly offered with Trinity College Dublin. This collaboration has ceased starting this year. How will this affect curriculum and overseas opportunities?
Okay. Yeah, this is already a decision made by SIT, and we are now launching our SIT-owned degree program for physiotherapy. So in terms of changes in curriculums, there's no changes in curriculums. But however, for overseas opportunities, we actually have a special component called overseas exposure programs. It is paused for the moment because of COVID-19 pandemic. We are actually looking into virtual OEP at the moment, and also we will definitely launch back the physical OEP once the COVID-19 situation is getting better. Yeah, so don't worry about that. And we are also working with various university partners overseas to look into the exchange programs. As a new university, we need time to establish this relationship with overseas counterparts. Yeah.
Thank you, Prof. Another question, is the demand for dietitians high in Singapore?
In terms of the demand for dietitians, I think the demand maybe not as high as physio or occupational therapies at the moment because the intake is smaller. Yeah, I would say there's a demand because I think we are looking into community-focused aged care and not just about aging populations, but also in various areas looking into both dietetic and nutrition. So that's why we always look into expanding the healthcare professional teams that will include dietitians. Yeah. So in terms of the intake, I think later on we can always revisit if this is your concern. Okay, but definitely there are demand. That's why we are still taking students.
Thank you, Prof. Okay, since we are on the dietitians, another question is, what are the differences between dietitians and nutritionists?
Well, I may not be the best person to answer this, but my understanding about dietitians colleagues that I've been working with is really about the looking into the nutritional values and also how the dietetic and nutrition input can help people to rebuild their muscle strength, rebuild their general health in order to be rehabilitated in a more efficient way. So that's my experience, but unfortunately, I won't be able to explain to you the other professions because I've never worked with the other profession before. Yeah, sorry about that.
No problem, Prof. Thank you very much. Okay, let's go to the students. So there's a question for Celine. Where are you going to be serving your bond and what will you specialize in the PT role?
Oh, where? Oh, okay. I'm actually going to Ng Teng Fong General Hospital, and in terms of specialization, I think it's not really confirmed yet. So like I said, I wanted to pursue neurological rehab. So hopefully I'll get that option at the hospital as well. Yeah, but yeah, it may also depend on the hospital availability and what the hospital needs as well. Yeah.
Thank you, Celine.
Okay.
Okay, another question. So this one is coming up quite a bit, and I just want to summarize the question. So if I'm from a non-health science diploma, can I still be accepted into the course like the physiotherapy or occupational therapy course?
Non-Singapore diploma.
Non-health science diploma, meaning maybe a diploma in engineering. a diploma in
Okay.
business?
Definitely. Yes, they can apply. And we do have a list of recognized diploma programs from all the polytechnics in Singapore. And do look out for the information from our main SIT website. It's all listed there.
Thank you, Prof.
Mm.
Okay, maybe a question for the scholars now. Maybe Su Hui, you can answer this one. So you guys are MOHH scholars, so I think the answer will be quite biased. But the question is, why an MOHH scholarship instead of an SIT scholarship?
I think for me, because the MOHH scholarship is very targeted towards the health sciences disciplines, and it also provides further development opportunities for you as a healthcare professional after you graduate, which is something that the school-based scholarships may not necessarily offer you. And because for me, I see myself being an OT for a very long time, so I hope to have that career development opportunity, which is offered by the MOHH scholarship.
Thank you, Su Hui. I think to add on to that, for the students, do go and do research on the various scholarships, sponsorship schemes available. I do think that there are differences between things like the bond period, things like the tuition fees covered. So I don't think there's a one size fit all answer. It depends on what really you would like. So another question for Prof. Tim, how is the accelerated OT course like? Is it for entry-level graduates?
Yeah, we're actually launching these accelerated OT degree programs this year. And we already had a Physio accelerated degree program launched, I think 2 years ago. So this is the 3rd year intake. In terms of the differences, because I need to let you know that the differences is we are actually consolidating everything. The 4-year degree programs into 2.5 years. Yeah. So it is a very, very intense programs. Yeah, in terms of students who might be suitable for this, we are definitely looking into entry level student with bachelor science in science in particularly, and we want students to really have a very good grade in order to cope with these accelerated degree programs within a very short period of time. Yeah.
Thank you, Prof. Another question is, so by having a nursing diploma, will it be an advantage to be shortlisted in applying for the PT and OT courses?
Well, we of course, hopefully, people from the healthcare field with diplomas will continue with their profession because they actually spend several years, at least 3 years, actually study the particular professions to support the industry. And of course, if they do decided to switch career to other healthcare professionals, we do consider. But in terms of advantage, there's a bit of advantage because they know the healthcare system much better. Yeah, but we actually, as Prof. Dumpingly mentioned, we take the equal measure systems, yeah, by looking into both the academic as well as the performance during the multi-minute interviews. Yeah.
Thank you, Prof. One question for the scholars. How can I better prepare for my interview?
I think if you are talking in terms of the school SIT's multiple mini interview, I think the multiple mini interview assesses more of your communication skills with others rather than your academic skills. So I think what you can do to prepare for that is to try and seize opportunities that you have now. For example, if you have projects or if you have leadership opportunities in school, those are opportunities for you to learn how to work with other people. And for the multiple mini interviews for my cohort, I remember there was a group section where you have to communicate with other people. And there's also an acting station where you'll be given a simulated patient and they will assess how you respond to the person's concerns. There was also a written test. And finally, there was an interview about why you want to join whichever course that you applied for. So I think soft skills is definitely something that's emphasized on in the interview, in addition to your academic skills. I think if you're talking about the interview as to why you want, the interview asking you why you wanted to join whichever course that you applied for, I think it will be very helpful for you to highlight if you have relevant attachment or volunteering opportunities that enable you to gain exposure in the field. And I think it will be also helpful for you to highlight some of your personal qualities that make you suitable to be a healthcare professional.
Thank you, Su-Hui. Okay, we have one question. Maybe I can direct it to the three of you. So in making a decision between choosing OT and PT, are there any general qualities and character traits that I can look out for myself to help me with my decision?
Student, you want to share why you choose PT, OT? I'll add on later.
Okay. Okay. So for me, I actually did consider OT as well, because in a way it's still a patient care, and the type of care they give is like similar, but just slightly like it's different, but it's still like direct therapy kind of care. So but what I felt that I wanted to work on for like patients is more of like the technical aspects, like and being able to help them with those kind of like physical functions. I felt like that was where I want to be. I want to help at that point of the patient's journey, right? Like I felt that being there, that part being part of that, but it felt more of like a PT's role, and I felt that suited me better in terms of like helping them with their physical function rather than their ADLs, like activities of daily living. I wanted to be part of that, helping them first with their physical functions. Yeah. And generally what PT learn may be different from what OT learns. So PT we may learn more about the in depth about the physical body, that kind of thing. And I felt that that was like more of my interest. Yeah.
For me, similar to Celine, I did consider PT as another option when I was applying. But for me, the reason why I chose OT is because I think it adopts a very holistic view of the person. So OTs can work with people who have mental and also physical conditions, as well as developmental conditions, whereas PTs would usually work with people who have more physical-based problems. And I think OT, I believe that sometimes a person's problem is bigger than just the person itself. So like Prof. Tan mentioned earlier, as OTs, you always consider the person, the environment, and the occupation itself. So there are several areas in which you can make change to help the person. So I really like that OT adopts a very holistic view of the person and the problems that a person is facing. So that's why I chose OT.
Yeah, thanks, students. I think as a faculty, definitely we recognize both professions are important because we do work hand in hand. That's why in SIT, we actually have a lot of interprofessional education opportunities for all students to come together to learn from each other, to understand each other's role better so that they can work as a team. But as an occupational therapist myself, the reason why I stay in this line for so long is because I think Su-Hui's quote is very good. What matters you actually is very, very important. We are very interested about people's doing. We want to help people in day-to-day life activities. And sometimes I call myself, I actually can be your life coach because in regards to your health conditions, and if you used to do certain things in the past, are you, going back to that particular life pattern again? And we actually can help you achieve that, whether by helping you to rehabilitate your physical functions together with physiotherapy colleagues, or whether we want to help you to regain your cognitive functions back in order to manage your own daily activities. Yeah, but ultimately it's about what they do, what they are interested about doing in a daily activity. Yeah.
Thank you, students and Prof, for sharing. I think as a healthcare officer myself, I would like to share also. So no matter the career that you choose in healthcare, no matter the discipline you choose, I think the most important thing that you need to have empathy, you need to have care for the patient, because these are all caring professions. So that's the very first thing that should be at the center of your decision when you want to choose OT and PT. Then I think you have the passion, you want to make a difference in others. Go and do research in the various OT and PT schemes. Go and do research in the universities, their teaching curriculum. I think you can go to Care Beyond. There's a lot of examples there. So yeah, so we have about maybe 5 to 10 minutes left. We'll take a few more questions. Questions for Prof. So do we source for our own clinical attachments or will it be assigned by the school? If is the latter, will we have a choice?
All students have to go through their clinical placement education. as part of the requirement of Allied Health Professional Council and also the World Professional Accreditation Body. And you, as a student, you may not have a choice of like where you want to go, because our CPE coordinators actually work very hard with different industry partners to create the slots for various settings. And the students must fulfill all the different components within the program itself. So unfortunately, we may not be able to please all students in terms of location, in terms of the field that they like to go for CPE. Yeah, so it is really about equalism. Everybody will have a chance to go to somewhere that may be nearer to their home, some places that they may like more than other settings. Yeah.
Thank you, Prof. Another question, to be working in a specific department for OT, does one need to further their studies upon graduation? So I think the question is asking about the postgraduate route is, what is it like and what can they expect?
Well, I think at the degree graduation level, that means you graduate from SIT with an honors degree. I think this certificate will definitely allows you to practice as a new practitioner. But in terms of further upgrading yourself to masters and PhDs, usually we recommend students to have some years of a clinical experience, because when you are doing your master, for example, SIT, we offer clinical masters, clinical rehab masters in the area of like going maybe to a certain specific fields by doing module-based research, module-based education, and also research component. Yeah, so it is about revisiting the theories and then also looking into some latest evidence and how we can enhance our care quality. Yeah, so definitely it's very rewarding, because personally I also took this route by further enhance myself, taking the postgrad and also PhD. But it's very rewarding when you move to different stage, when you realize actually you are already somewhere up there, in terms of clinical skills, but you want a little bit more so that you can actually do better, or you want a little bit more so that you can actually coach your juniors better. Yeah, so learning is never ending. So definitely, yeah, the option is available locally. Yeah, and we also have a doctorate in, we have a clinical doctorate in SIT as well. So it's just a bit of a publication. Yeah.
Thank you, Prof.
Yeah.
I think to add on, right, personally for me, I'm in my 30s, and I think in the past, when I was in my 20s, or maybe I was 18 or 19, the careers in healthcare and the education options, the career paths, they were not exactly that fleshed out in the past. So, for example, in nursing, right, I was a poly grad when I was going to choose my course. When you look at nursing, I think there were no such thing, or rather it might not have been publicized or very inaccessible. No such thing such as nurse educators, no such thing like APNs. I think same goes for the healthcare disciplines. At that point of time, I think the strategy and the MOH strategy at that point of time was to quickly build up a healthcare force. And I think it's very different now, because now you have the different specialties, you have the different education tracks available in Singapore. I think SIT has been building up the courses over the years. If you realize, last year we had the speech and language therapy course. We also have the dietetics course. We have quite a number of local uni courses that you can take now. So I think it's a very different scene compared to the past. And I think when you go to SIT, when you go to your hospitals or institutions, for example, your supervisor or your lecturers, professors will be more than willing to share with you what you can do next. So don't worry about the career path. I think it is very, very bright. So, okay, question for the scholars. Do you get to plan your own timetable in SIT, or is there a fixed timetable for different students in different courses?
Oh, okay. We don't actually have we can't plan our own timetable, and our timetable actually changes every week. So like all this is really pre-planned. So I guess you don't have to worry about it, about like bidding for mods or that kind of thing. So it's just, you just go for class according to your timetable. Yeah.
Thank you. Another one, right? What's the best part of university life?
For me, I think like what I mentioned earlier, I really enjoy practical classes because it's a lot of fun to be able to see like what you can actually do and how you learn by putting what you've learned in theory into practice. I think another big part of my university life that I really enjoy are my friends because sometimes it's very hard to get friends who are outside of healthcare to relate to what you face. Whereas if you talk to your friends in healthcare, all of them go through the same thing as you. All of them can understand your problems and they can help you to feel more understood. So I really like being with my friends and going for classes with them.
Thank you. Another question for the scholars, right? Are there electives or minors that we can choose to go along with the physiotherapy course?
I think there isn't minor in a way. Yeah, I don't think there's a minor that you can take to pair with your course. But I think in the clinical practice, right, years, which is your year 3 and year 4, you can take one elective. Yeah, if I'm not wrong. Yeah. So you get to like choose like which one perhaps like you may want to learn more about pediatrics, then you can take the pediatrics elective. That kind of thing. But it's still within the scope of physiotherapy practice. So I don't think there's a minor that can be paired with it. Yeah.
Thank you, scholars. I think we have enough questions for now. We'll be wrapping up this segment, and I think next off we will have Prof Team who will be sharing with us. So thank you, students. Thank you, Prof Team, for answering the questions. The next segment, which is by Prof Team, is a virtual campus and HSS labs tour. So it's quite cool because it's virtual, and I think you can see things like I think I saw a human cadaver the other day. So do tune in to Prof Team's sharing, and Prof Team, I will leave you to share your screen. Thank you.
Okay, yeah. So let me share my screen. All right. So let's start our virtual campus tour. And we actually developed this just recently for the recent open house. So this is actually our headquarters, SIT at Dover at the moment. And this is our main gate. Yeah. In fact, when you enter the main gate, you will see our tower block. Yeah. So this is the main entrance. So let's take a look.
Ambassador studying in electrical engineering and infocom technology.
And I'm Angel, a year 2 student doing a degree in chemical engineering. And together, we will be taking you on this virtual tour at SIT at Dover.
And right now, we are at the main lobby of our campus, located in the University Tower. This is where our reception counter is, as well as the architectural model to showcase our future campus. You can also click on the button on the right side of your screen to see how future campus in Pongko looks like.
To begin your tour, click on the arrows to find out more about the campus. See you around!
Okay, so to zoom into health and social science labs, and let's begin with our first lab tour to HSS. All right, and this is our common HSS lab. In HSS, we call it common HSS lab because we don't want like a specific programs to own a lab. I think that's the culture of interprofessional collaboration, starting from university level. And you can see we have analytical models that allow students to borrow and study after class time. And we also have posters along the walls in the corridor for students to for self-study. Yeah, and we actually have, let's start from this lab, Skill Clinic 6. You can see we have gait analysis equipments there for students to learn how to analyze gait patterns. Yeah, and this is mainly used by physiotherapy students, but we do use this space for other program-specific education as well. All right, and then outside this next door, we actually have the mock-up HDB flat. Okay, let's enter and have a quick look. So in this lab, we actually have our wheelchairs, we have our dining tables, we have our laundry sets, we have our mock-up toilet, okay, which is up here. We create simulated environment for simulation training. Maybe students will be given a case study, so they will practice with peers how to get into the toilet with modifications like grab bars. And then we also have the ramps that's movable for students to play around. And then we also have the living, the bedroom here for students to practice transfer from the normal bed to the wheelchair. Yeah, and then we also have the wardrobes. So this is a mock-up flat, right? And let's go to another lab. And the lab next to the mock-up flat, we have the anatomy lab as well. And you actually can see we have all this anatomical models again for students to study their anatomy. I think one main challenge for non-science students, especially from a diploma in other non-science programs, they might find it challenging in coping with this anatomy and physiology module. Yeah, so at the moment we conduct these anatomical labs in the NUS University Medical School because we do not have a wet labs in SIT campus. So this is another one. Let me show you another lab here. And we actually have the mock-up kitchen for OT students, for dietetic students, for speech and language students to practice, their cooking skills, their feeding assessments, their swallowing assessments. All right. So this is a real kitchen that we can actually use microwave. You can use the induction cookers to cook real food. Yeah. And let me show you another lab. We also have a human performance lab where you can see all the high-end products, okay, looking into people's performance capacities. Yeah, we have the treadmill, looking into people's heart lung systems, okay, and we also have the bicycles and yeah, and arms and leg. We also have another equipment there to look into their muscle strengths. So this is one. It's technology focused. And this lab is mainly used by physiotherapy students. Let's move to another lab. This is the lab that is mainly used by diagnostic radiography students. Okay, so students will learn how to read images, yeah, from CT scan, from MRI, yeah, and as part of their practical sessions. Yeah. And we also have another sensory lab. Is mainly used by dietetic nutrition students. Yeah, so you can see we have a lot of kitchen staff that students actually learn how to cook and how to analyze nutrition in this sensory lab. We have covered this kitchen, living room. We have covered this. Okay, let's move to the simulated ward. And this is the mini simulated ward that we have in SIT at Dover. And you can see we have the mannequins, we have the hospital beds, and we also have wheelchairs stored inside this room for students from all programs to practice their clinical skills, yeah, including communication. And we also conduct assessments in this lab as well, how to handle patients in the hospital environment. And of course, we actually have another recently built mega lab. We're actually able to host like more than 100 students at the same time for their practical sessions. So this is a shared lab mainly by physio and occupational therapy students to practice their physical handling skills, to practice their physical examination skills. These are all the treatment cultures, or we call it plinths, so that they actually work in pairs to do physical examinations, functional examinations. And we actually have a camera systems, and tutors and trainers will be able to do demo in front, and the camera will be taking the videos and then project to all different screens around. We have a lot of LCD screens in the lab itself. Yeah, so that's one of the biggest HSS lab in our SIT campus. Yeah, so yeah, and of course, when we come to this campus, there's another entrance. We have two entrances. Besides a tower block, we have another entrance to Academic Plaza, where all the faculty is sitting on top. And we actually have the Academic Plaza foyer, the lobby of this building. And you can also see that we have the mini HSS garden, all right, that actually managed by occupational therapy students. And as part of my module, we conduct gardening activities to look into how can we introduce horticulture therapy or therapeutic gardening activities to people with different health conditions. Yeah, and maybe before we end, let's take a quick look at our classrooms. Yeah, so SIT as a technological university, we invest a lot in terms of technology in teaching. So this is our smart classrooms that we have the we have all the mobile, we call it cows, okay, a computer on wheels. The student can share their screen to the rest of the class, and also the tutor can share their screen to all different cows for more effective learning. Okay, so I think that's all from my lab tour. Okay, and hope we'll see you one day in SIT campus. Yeah, thank you.
Thank you, Prof. Tim, for sharing the virtual tour with us. I think there are some participants asking in the chat, where do I download the link? And I think the link is at the SIT website. There's a virtual campus tour at the website, so you can go ahead to look at it in your free time.
Yeah.
Next up, we have Prof. Tariq, who will be conducting a virtual anatomy class for us. So Prof. Tariq, you want to take over, please? Thank you.
Thank you, Nigel, for the introduction. Just a minute to share my screen. Okay, good morning to all of you. My name is Dr. Tariq. I'm part of the Health and Social Science at SIT, and I'm here to talk to you a little bit about anatomy. Before we begin, of course, you already heard from Prof. Tim and Prof. Bing Lead that anatomy can be a little bit challenging, but we need to understand why do we study anatomy. So in order to be able to go into any of the programs at SIT, the health programs at SIT or at any university actually, the first initial or basic step is to understand how our body is built and how are the system functioning with each other. Without this basic understanding, you will not be able to comprehend the therapeutic methodologies that are being discussed in different programs. In order to treat something, you first need to know how it functions and how it looks like in the normal setting. So in anatomy, we discuss the normal body parts. We teach you how the normal body parts look like, how they are functioning together. And then the specific function of each system is further discussed in the physiology component of the module. Although it can be a little bit challenging, but it's also a very rewarding module. And I believe most of your friends, after they have gone through it, they really appreciate the course once they start studying the particular parts in their respective modules. So currently, like Prof. Tim mentioned, we usually give our practical classes at NUS because they have the anatomy hall where we can have direct interaction with silent mentor, which is a very important experience for you to learn from. At the same time, at SIT, we have our own lab, anatomy lab, which you have seen part of it. Other parts consist of, for example, VHAB or Virtual Human Anatomy Program, which is the one that you can see in the picture right here, where your friends are using the VHAB system to look at the heart. I will try to show you pictures later from this software. Also, we have another machine there that is called Anatomage. Anatomage is a simulation anatomy software that is in the full human size, where the students can look at the human body and do a virtual dissection using that machine and go from one layer to the next to explore various muscles and systems. Okay, with that being said, perhaps we can start our talk today about the anatomy of the heart. So to begin with, what is the heart? When we say the heart, what do we actually refer to? So the heart can be defined as part of the cardiovascular system that is responsible for pumping the blood supply to all the organs and all the system in our body. We probably all have images in our brain about the heart, right? So it usually looks something like this. Oh, not this one. This is the one that you see in the movies, okay? This is not how our real heart looks like. So moving forward, this is an actual diagram of a real heart. Again, this is not a real heart. This is a diagram that has been drawn to the heart, okay? We will now try to know about these different parts in the next slides and identify each of them to be able to grasp the function and how to look for that. In the next picture, I'm going to show you how a real heart looks like from a silent mentor. And of course, it does not have this bright color for identification of different parts. So here we can see how a real heart looks like. As you can see here, we cannot see the blue, we cannot see the red. It's just the heart as it is in our body. Okay. So moving forward, the heart is usually divided into four chambers or four different compartments. These four chambers are 2 atrium and 2 ventricles. The two on top are the atrium. We have right atrium and left atrium. The two below the atrium, these are the ventricles. We have right ventricle and we have left ventricle as well. So if you want to describe the heart, if you want to go back to the previous slide, by looking at this shape, we can describe the heart as pyramidal in shape, with the apex pointing downwards and anteriorly, and the base is on the top. Okay, so the apex is pointing downward, what we call in anatomy inferiorly, and in lateral direction, meaning going towards the border of our body. And we said that the base of the triangle is towards the back of the body. So we just mentioned that the heart is the organ responsible for pumping all the blood throughout different systems and organs of our body. It's normal to think, is this organ protected, well protected? It's very important to our life, right? So in the next slide here, we're going to discuss about the coverings of the heart. The heart is actually covered in place completely from all around with the main vessels as well. These are the main vessels, which we will discuss in a minute. Okay, so all of this is covered with what we call pericardium. Pericardium is a sac that is covering the heart. So pericardium has different layers. The first outer layer, which is this one that you can see right here where I'm pointing my cursor, this is called fibrous pericardium. Okay, the fibrous pericardium, this is a tough layer that encapsulates the heart, and it offers protection as well as attachment of the heart. After the fibrous layer, we have the serous layer, okay, which is these two layers. So the serous layer have two layers within. One is the outer parietal layer, and the other is the inner visceral layer, or epicardium. So one more time, pericardium, this is the entire covering put together. Epicardium, this is one layer of the serous layer. If you look at this diagram here on the right, you see a fist being pushed into a balloon. This blue here, this is a balloon. This simulates our heart and its covering. So if we can imagine that the fist is the heart, then here, this is the base of the heart, and here will be the apex of the heart, right? As it is pushed inside the balloon completely covers the hand or the fist, right? So these two layers of the balloon are the serous pericardium. So the inner wall of the balloon right here, this is epicardium. Okay, so this is the one directly in contact with the heart itself. The outer layer, which is right here, this is the parietal pericardium, this one. Okay, you can see that there is space between these two layers. And this is called the pericardial cavity and contains pericardial fluid or serous fluid. Let's look at what we just discussed in wordings to be easier for you to follow up. So we said the pericardium is a sac covering the heart. It is formed of two layers, outer fibrous layer and inner serous layer. The fibrous layer protects the heart and provides attachment to stabilize the heart in position. The serous layer can be subdivided into parietal and inner visceral. The inner visceral, we call it epicardium or epicardial layer, okay? So the space between these two layers is called pericardial cavity, and it contains serous fluid. The serous fluid functions in this location as to reduce friction. We know that the heart is pumping the blood. Pumping the blood means that the muscle itself is contracting and relaxing, contracting and relaxing. This would normally create friction. So to reduce this friction and to minimize its effect on the cardiac muscle and its surroundings, we have the serous fluid in the pericardial cavity that allows for smooth pumping of the heart with reduced friction as much as possible. The heart muscle itself is called myocardium. Okay, so far we've discussed three different anatomical terminology. One is pericardium, and this is the entire covering of the heart. The second is epicardium, and this is the inner layer of the serous layer. Okay, and the myocardium, and this is the actual muscle of the heart itself. Okay, before we go further, let me share with you how this looks like in our body. So I will share a 3D program to show you that in a minute. Okay, here we have the 3D program. We have removed the muscle layer, so we only have the bones and some of the internal structures. The heart is well protected inside the rib cage, all of that, we call it the rib cage. To be more precise, here we have the sternum in the middle, and then we have the ribs, first, second, third, and so on. And this bone here, we call it the clavicle. Okay, so let's remove these bones to look underneath. Okay, so this is what the heart looks like. This entire structure is the lung. Which lung? Is this the right lung or the left lung? This is the left lung. And as you can see, it's covering a big part of the heart right here. This notch in the lung is called cardiac notch because it gives position to the heart itself. Now we are looking from an anterior view of the heart. So if I move it like this, now we are looking from a posterior view of the heart. We already discussed that the heart has 4 chambers, right? 2 atrium and 2 ventricles. These structures will differ according to which location I'm looking from. So right now I'm looking from anterior view. So in the anterior view, I can only see 2 of these chambers, this one and this one. This one right here, this is the right atrium. One more time, this is the right atrium of the heart. Below it, right here, this is the right ventricle of the heart. If we move to that side, we have the left ventricle of the heart, which is this one. And on the back, we can identify the left atrium. So that means that the left atrium can only be seen from a posterior view, while the right atrium can be seen from the anterior view. The real heart in the human body is in the size of a clenched fist. So if you clench your fist like this, usually this is the size of our heart. We said it is pyramidal in shape. It has a base and an apex. So this is the apex of the heart, this part that I'm pointing to right now. Sorry, this part right here. And here is the apex, is the base of the heart. So the left atrium acts as the base of the heart. So the entire heart is resting on the left atrium on its back right here. Okay. Let me remove these vessels. So we can get a clearer view. Okay. So again, this is the posterior view of the heart. We have the left atrium and the left ventricle. This is part of the right atrium, which we can also see from the posterior view. So here we see the right atrium and the right ventricle. Now let's discuss about the main vessels that are arising from the heart or coming into the heart. So let me get back to the main vessels right here. Okay. So right now, I have just removed the pericardium that is covering our heart. All of this is the heart, and all of that is the vascular system that is delivering blood supply to all our body parts and organs. I put it all together so you can get an overall view, but please don't get confused by the so many vessels around here. In a minute, I will just erase those and leave the main ones. So if we look at the right atrium, this is where all the blood from the body is being collected into the right atrium. This is done through the superior vena cava right here and the inferior vena cava. Both of them empty the collected blood from all of the body into the right atrium. Bear in mind that this is deoxygenated blood. It does not have any oxygen. So it's the heart's function to send it to the lung to be oxygenated and then receive it again and send it out to the entire body system. Okay, This vessel right here, this is the pulmonary trunk, okay? As you can see, the pulmonary trunk arises from the right ventricle. Here we have the right ventricle. So the pulmonary trunk takes the blood from the right ventricle and distributes it to both sides of the pulmonary tree. The pulmonary tree, as we mentioned before, will be covered right here with the lungs. Okay, once the blood reaches the lung, it will be oxygenated. It will receive its oxygen as it is passing around the alveoli of the lungs. Okay, after that is completed and the blood is oxygenated at these vessels, then it is collected back from the lung through these vessels right here. Okay, we call these the pulmonary veins. Okay, so let's go back. Now we are looking from a posterior view of the heart. Again, all this part, this is the left atrium. We have 4 pulmonary veins right here, 1, 2 on this side, and 1, 2 on the other side. Okay, 4 pulmonary veins that collects the oxygenated blood and returns it back into the left atrium. Okay, we go back to the frontal view. After the oxygenated blood is collected in the left atrium over here, the left atrium empties the blood into the left ventricle, and then the left ventricle pumps the blood to the entire body through this vessel, and this is the aorta. So we call this part the ascending aorta, and this is the arch of the aorta, and after that, if you look from the back, we have the descending aorta. Okay, so let me remove all of this and we go back to the heart itself to be easier for you to follow. Okay, so here we only have the heart itself. We already identified this as the superior vena cava, inferior vena cava. All of this part of the heart, this is the right atrium. Here we have the right ventricle. We identified this as the left atrium, and this is as the left ventricle. These vessels that are coming into the left atrium are the pulmonary veins. Okay, and although they are veins, these are carrying oxygenated blood. Okay, then the blood will pass into the right ventricle, and then the right ventricle will pump it through the aorta right here to be delivered to the entire body. Okay, if we remove this part of the heart, then we get a section inside the heart muscle itself, or the myocardium. We mentioned that these are 4 different chambers. These chambers are connected by gates. Okay, we call these gates valves. So this is the valve, all of these parts, 3 parts to be more precise, that are connecting between the right atrium and the right ventricle. All of this space, this is the right ventricle. So we call this the tricuspid valve. Okay, and then here we have another valve that is connecting between the right ventricle and the pulmonary trunk. Okay, if we move into the left ventricle, which is this one over here, all of this is the left ventricle, we can see inside this valve, we call this the mitral valve or bicuspid. We call this tricuspid because it has 3 cusps. Each one of those is a cusp. Okay, we call this bicuspid or mitral because it only has 2 cusps. Okay, and this is the bicuspid or the mitral valve. This is connecting between the left atrium and the left ventricle. After the blood is collected in the left ventricle, then the left ventricle will pump and push the blood into or through this cusps. So these cusps are for the aortic valve. All of that, all the 3 of them, these are the aortic valve. They will open and allow the blood to pass from the left ventricle into the aorta itself to be delivered to all the remaining parts of our body. Okay, Now let's go back to our presentation and try to get more details on this. Okay, moving forward, again, these are the parts that we just discussed in the previous slide. So here we have the superior vena cava. Here we have the inferior vena cava. Both receive deoxygenated blood and empties into this chamber, which is the right atrium. The right atrium will then pass the deoxygenated blood into the right ventricle over here through this valve, which is called the tricuspid valve. Then the right ventricle would contract to pump the blood through the pulmonary trunk. The pulmonary trunk will then take this deoxygenated blood into the lungs to be oxygenated, so it can receive oxygen. Then the blood collected from the lung will come back through these 4 vessels. These are the pulmonary veins. We have 2 on this side and 2 on the opposite side over here. You cannot see the other 2 right now. Okay. All of these will empty into the left atrium. And again, at the moment, we're talking about oxygenated blood. The left atrium will then empties the oxygenated blood into the left ventricle through the mitral valve. The left ventricle will then pump or contract to push all of this blood, following this arrow here on the back, the red arrow, through the aortic valve and inside the aorta, ascending aorta and aortic arch right here. Okay? So again, this is the cut section that we just saw from the 3D software. You can see the tricuspid valve. The tricuspid valve is connected by thin fibers, which we call it chorda tendini. Chorda tendini is attached to the valves on one side, right here, okay? And then attached to these muscles, which are inside the ventricles. These muscles are called papillary muscle. So what happens, the valve is in this position. When the papillary muscle contracts, it pulls the chorda tendini to open the valve. So it's like a rope or a small cord. When you open it, when you pull it, it opens the valve to allow the blood to pass through. Okay, so one more time, these small tendons, these are called chorda tendini, and they are attached to the papillary muscle inside the ventricles of the heart, which when contract, they pull the contracting tendini, and accordingly, they open the valves. The right ventricle and the left ventricle are separated by the interventricular septum. All of this part is called the interventricular septum, and it is separating the right from the left ventricle. Okay, let's move forward. So as we discussed these valves, we need to know that it is important to recognize the sounds of each valve separately. So where would we look to hear for these valves in a living patient? Again, this is the sternum bone, as we just said, right? And here we have the clavicle. So we'll use those as our reference. For the aortic valve right here, it is best heard on the right side, the second intercostal space. This is the second intercostal space right here on the right side. So if you put the stethoscope, this is what the doctors used to hear, the sounds in our body. If you put it on the right side of the sternum, you'd be able to listen to the aortic valve. If you put it on the opposite side, so the left side, again, for the second intercostal space, you'll be able to listen to the pulmonary valve. Okay? If you move down to the fourth intercostal space, right on the left side of the sternum, you would be able to listen to the tricuspid valve. Okay? While the mitral valve is best heard at the apex of the heart. So the apex of the heart can be surface marked by drawing a line from the 5th intercostal space with the mid-clavicular line. This is the clavicle. So if you say a mid-clavicular line running here, then here would be the apex of the heart. Okay? This is an easier picture of what we use in real life to listen to these parts. Another way to identify the apex of the heart easier is just below the nipple of the patient. Okay? So below and slightly on the right of the nipple of the patient, you can listen to the apex of the heart. Okay, moving forward, in an X-ray, this is what our heart looks like. In a normal X-ray, this is what our heart looks like. Again, these both are X-ray. One is taking from antero-posterior direction. The other is taking from postero-anterior direction right here. Of course, we can see the bones more clear because the bones are harder structures, so they don't allow passage of the X-ray. Okay, here, just a minute. Okay, here are the blood vessels that supply the heart itself. As the heart is a muscle, it needs as well oxygenated blood to perform its function. So how does the heart receives its blood to perform its function? There are two main arteries that supply the heart. These are called coronary arteries, okay? So here we have the right coronary artery, and on the opposite side, posterior to the pulmonary trunk, we have the left coronary arteries. These two coronary arteries are the one responsible to provide our heart with oxygenated blood. Both of them, they arise from the base of the aorta directly. Okay, after the blood supplies the cardiac muscle to perform its function, it needs to be drained out. Drained out means to be taken as deoxygenated blood and sent again for oxygenation. So the main vessel that drains all the blood from the heart, this is the coronary sinus. And this is the biggest vessel that you can see on the back of the heart here. It is on the groove between the left atrium and the left ventricle. We have this groove here. Lying inside the groove is the coronary sinus. All the other veins of the heart drain into the coronary sinus. Then the coronary sinus will open directly into the right atrium, okay, to deliver the deoxygenated blood or the non-oxygenated blood into the right atrium so that it can get a chance to be oxygenated again. So again, this is the coronary circulation. We said it receives blood supply from the right coronary artery and the left coronary artery. Both arise from the aorta. And the main vein that drains the heart, this is the coronary sinus. It can be seen on the posterior surface, and it empties directly into the right atrium. So how does the heart actually pump? What makes the heart pump? There are electrical signals that generated and travels through the heart or cardiac muscle to give it the signal to pump in this rhythmic way. So we have two nodes that are responsible for sending these electrical signal. One is called sinoatrial node or SA node. The other is called atrioventricular node or AV node. These two nodes are responsible for sending the electrical signals to allow our heart to pump in a normal rate without increased pumping rate. This is called tachycardia, or decreased pumping rate, slower, which is called bradycardia. Okay, so what are the main clinical conditions that we hear about when we are talking about the heart? Usually, these are conditions that affecting the blood supply to the heart. So they are affecting the coronary vessels. That is why they're called coronary heart disease, or CHD. Okay, so what can happen to these coronary vessels? One of the reasons could be atherosclerosis, which means thickening of the blood vessel itself due to presence of a lot of fat deposits, okay, or fat deposition on the walls, Thrombosis is coagulation of a blood inside the vessel. This should not happen in normal condition, but in certain diseases can promote thrombosis if one of these coagulation get interrupted inside the artery that is supplying the heart. Then the heart will not receive a sufficient blood supply. High blood pressure and diabetes or smoking are all predisposing factor to coronary heart disease. So the two most common names that we hear about heart conditions are angina pectoris and myocardial infarction. To explain it simply, angina pectoris is a reversible condition. So this is a temporary occlusion or a temporary stopping of the arterial blood supply to the heart. Okay, temporary means a small period of time after which this occlusion has been resolved. During this period, the patient will suffer from pain radiating, pain on the left side, okay, and radiating to the left arm. If this angina pectoris is prolonged, so the occlusion was not resolved for a long period of time, then we have myocardial infarction. The word infarction means death of the muscle. So myocardial infarction means death of the cardiac muscle. So depending on which blood vessel that was occluded, then the muscle that is supplied by this blood vessel, if it does not receive blood supply for a long period of time, this muscle will die. So again, angina pectoris, this is a reversible condition. It can be treated. Myocardial infarction, if the cardiac muscle dies at this location, it cannot be treated. Again, this is part of the cardiac muscle because we have several branches supplying different parts of the heart. So usually when occlusion happens, it's in one of these branches. So the muscles that are closer to these branches will be affected with the myocardial infarction, while the rest of the heart will still be beating. That means that the patient will still be alive, but will have either irregular beat or weak beating of the heart, not sufficient to provide blood supply to the entire organs or cause, for example, low blood pressure. Okay, I don't want to take too much of your time. I just want to give you a brief about what we study in the anatomy. And usually this lecture will be followed on by a similar lecture in physiology describing the action and the function of the heart to the entire system of the body. Thank you. That's all for me. So now, I don't know, do we still have time to share a Kahoot? Nigel?
Yes, we do have time. Please, you can go ahead and share.
Okay, so I will share with you a Kahoot quickly, just to revise the information that we just discussed right now. Let me go to the page. Okay, I will wait for 2 minutes for you to join in the Kahoot, and then I will start. Again, before we start the Kahoot, I want to express that this is just for revision. Even if you get the answer wrong, that is still fine. It's just to stabilize the information that we quickly discussed right now. So 1 more minute before we start.
Just to also mention, we'll be giving a voucher for the highest scoring, the highest score in the Kahoot. So just to test whether you were paying attention.
Okay, perhaps we can start now for the sake of time. You can join in later again using the PIN code if needed. So the PIN code is 763905. Okay, I will start the Kahoot now. Still have about 25 seconds to give your answer to the first question. Okay, 6 of you got this one right. The correct answer is the pericardial layer and the visceral layer. Again, we're talking about the pericardial cavity. So this is located between the parietal layer and the visceral layer. Okay, so I will move on to the next question. So here we want to know where to put the stethoscope to best listen to the pulmonary valve. Okay, very good. For this question, 15 of you got this question correct. The best place to listen for the pulmonary valve is the second left intercostal space. Excellent. Okay, moving on. Again, this question is where is the best place to listen for the atrioventricular valve? Where do we put the stethoscope? Okay, apparently this question was a little bit difficult for you, but still 9 of you got it correct. So the right answer is at the second right intercostal space. This is the best location to listen to the atrioventricular valve. Moving forward. Where does the pulmonary trunk arise from? Okay, 12 of you got this one correct. The pulmonary trunk arises from the right ventricle to send the deoxygenated blood to the lungs to receive the oxygen supply. Okay, moving forward. This is the last question. How many blood vessels open into the left atrium? Okay, only 8 of you got this one correct. 4 is the correct number. Remember, this is the left atrium, so it is receiving 2 pulmonary veins from each side. These are carrying the oxygenated blood from the lung back into the left atrium. 2 pulmonary veins from each side, that makes the total 4. Okay, let's see our board for winners. The third place goes to T. The second place goes to Joe. And the first place goes to Wilun. Thank you for participating. Also, Ben was a runner-up as well. Okay, thank you. Thanks, Nigel. That will be all for me.
Okay. Thank you, Prof.
guys.
Tariq. So
if they have any questions regarding this short lecture, they can still ask question using the chat as well.
Yep. So please ask your questions using the chat. And I think Waylun, please do contact us. You can go to the tech support there and drop us a message, but we should be able to find you. So Prof. Tariq, thank you very much for sharing. It has been very interesting. Brought me back to my school days. For the next segment, we'll be having Min and Ashlyn share with us on the application process at SIT. So Min and Ashlyn are the admissions officers from SIT. And do note, we'll be having a Q&A session after this, so you'll be able to ask them questions as well. Min and Ashlyn, please.
Thank you, Nigel. Thanks so much for the introduction. Let me quickly share my screen here. Okay, I hope you can see this. So yeah, hi, my name is Min from the Admissions Division. So in this segment, I will be covering an overview about admissions related information, such as admission requirements, our application process, as well as some brief information of our scholarships, as well as financial assistance schemes that we offer in SIT. So you may ask, what is the admission requirements? Perhaps before I go into the specifics, let me quickly play a quick video to share what type of students we are looking for. So Nigel, would you help me play the video, please?
If we were to put universities on this spectrum of theory to practice, then SIT would fall very much on the practice edge side of things.
I always found it difficult to understand the theory first and then the problem. I put a lot of effort into making sure that everyone understands the problem first. Because I think when you present theory first, it becomes like this mystical phenomenon, but it's definitely not the case. But when you present the problem first, the kids actually go through the pain of, I don't know which one is right. You know, it's so realistic and it really mimics a real engineering career.
Students actually get exposed to relevant activity that's important for them to secure a job in the future. So they do more hands-on activity and practical-based lessons rather than going through textbook-based courses.
Thanks very much for that. Let me just go back to my presentation slide. So in general, SIT practices a holistic and aptitude-based approach in assessing applicants for admissions. So what that means is that we do not judge and admit students solely based on their academic grades, but rather apart from meeting the minimum academic threshold, we take into consideration the student's passion and interest, as well as whether the students may have taken up relevant job shadowing opportunities or work experience, and also their co-curricular records. So we do look into every single student's personal statement, which is part of the application when they apply to us, and it shortlisted the interview performance. Okay, let me just, sorry, I think I may have missed my slide previously. So yes, I would like to also add that in SIT, we have also published our first indicative grade profile that will help you make informed decisions in terms of your relative standing compared to your peers. So the indicative grade profile table shows the academic grades in banding for a specific program in the last admission exercise. And it will also give you an indication of the number of places that's available, as well as the most recent 2019 employment rate, as well as the median salary. So application exercise and intake is once a year. And the application typically opens from mid-January to mid-March. So application is currently open. All the applications are to be submitted online via our SIT website, which I've given the link over here. And you will have up to 5 choices in your application. And if you are required to serve your national service in Singapore, a place will be reserved for you if you're successful in your application. Now, I'm going to give you some tips, that you may ask us for advice on what you may want to take note of to help boost your applications. So first and foremost, when you're deciding on what course to study, it is important to do some research and self-reflection. How passionate or interested are you towards the course you have chosen? Why do you think this course or career should or would sustain your interest in the long haul? And of course, there are also practical aspects, right? Such as whether you have met the subject prerequisites, and if you have attained a relevant academic background in order to sustain the academic rigor of the university life. And since it is an application season right now, and our application is currently open, do think through the courses you're applying for. And the course choice order is something that you should take into consideration. So let me just give you an example. In SIT, as I've earlier on mentioned, applicants have up to 5 choices in their application. So we will typically review each application based on the order of the choices. To give you an example, if you have indicated, say, physiotherapy as your first choice and have been successful in your application, you will then be given an admission offer for physiotherapy, and we will thus not review you for the subsequent choices in your application. However, if you have not been successful in your first choice, then we will review your second choice, and so on and so forth. Okay. I would also like to stress the importance of the personal statement, as I've kind of alluded earlier on in your university application. It is a chance for you to articulate why you would like to study a particular course and what skills and experience you might possess that shows your passion as well as your interest in your chosen field. You could also share information of non-academic participation and achievements, which review your soft skills such as leadership qualities, collaborative abilities, critical thinking, reasoning and communication, etc. So moving on to tips for performing well at the interviews. I'm just going to share this quite generically, across all the programs that we offer in SIT. So I think it is very important for you to think about your passion and interest. I think we've shared that quite a fair bit, I think, throughout this whole morning already. And do some research on the programs and the related industry to ascertain if your interests and the courses that you intend to pursue are aligned. I think you should also be prepared to explain, to the interviewer, if you're called for an interview, why you're interested in your chosen field, and also outline your motivations for enrolling in the course that you've applied for. You can also demonstrate your interest by reading up on the latest news, research, and development in the field or the industry. Consider practicing some of the commonly asked university admission questions with your friends or family before your interview. And be sure to get used to being able to develop your thoughts and communicate your ideas and arguments under a time constraint. Okay, because sometimes you may be only given limited time to share what you would share your answers. Okay, and although university admission interviews are usually fairly informal, I think what is best is to still be dressed up rather than dressed down, even though it may be on a virtual setting as well. So you may want to wear clothes you would wear for a formal job interview, for example. You want to look smart, you want to look comfortable so that you make a good impression. Last but not least, I think it is also very important to be yourself. I think what we really want to know is to know the real you, understand your motivations on pursuing the chosen course, and whether you have the right attributes in pursuing the course that you have applied for, as well as the healthcare industry in this setting. So I'm going to quickly share a little bit more about our scholarships and financial assistance schemes now. But in general, there are 3 main baskets of expenses when it comes to university education: tuition fees, living expenses, and enrichment programs. And over at SIT, we have more than 300 scholarships and financial assistance schemes for our students. And 1 in 2 students have either received a scholarship or bursary. In fact, over 20% of our allied health students are actually on a scholarship scheme. So there are, as I've shared, scholarship opportunities in SIT. And the most prestigious scholarship will be through our SIT scholarship. And then we also have external and donated scholarships for our students to apply to. And these scholarships are typically highly competitive. And we're thus looking out for students who are all-rounders, who have not just achieved academically, but they must also exhibit evidence that they have contributed back to their community. In SIT, we are also committed to providing students access to a university education without letting any financial challenges get in the way. So students who require financial assistance can apply for these financial assistance schemes. So with that, I have come to the end of my segment, and I'm very happy to open the floor for questions.
Thank you, Min, for your sharing. So I'll start the questions rolling. Mostly admissions questions as of now. So the first question is, will you be bringing the radiation therapy program back? Will it be renewed?
I think to quickly answer the radiation therapy program, I think Tim also you can help chip in a little bit here. Currently, we are holding this back. It's currently in review. Not just among within SIT, but reviewing this with our industry partners as well as MOH to ensure that we don't want to start a program where there is a shortage of job opportunities. So this is currently in review. But then I think in the subsequent years, when there's a need for or at least there is that demand for radiation therapists within the local region, we will certainly bring that back. Tim, do you want to add on to that, or yeah, okay with my answer?
Yeah, I think I have nothing to add. Thank you.
Thank you,
Sure.
Min.
Yeah, we'll move on.
Okay, moving on. There's another question. Is what is the probability of getting into a dietetics course? So I guess the question is asking about the competitiveness of the course.
Okay, Ashlyn, would you like to help with this? I think you have been helping out with the dietetics program, right?
Okay, so for the dietetics program, it is actually quite competitive because of the lower cohort size. So based on the indicative grade profile, you'll notice that for previous, for AY 2020 last year, we actually have less than 20 places available for the program. But for this year, due to the increased demand for dietitians, we actually have around approximately about 25 places for dietetics this year. So in terms of how the probability of getting into the dietetics program, it is actually also dependent on the course subscription rate. How many, it's also hard for us to know how many candidates will be applying for the dietetics program this year, but the number of places will give you some kind of a sensing of the competitiveness of the program. But ultimately, other than your academic results, it's also largely based on how well you perform in the multiple mini interviews as well. Yeah.
Thank you, Ashlyn. Since we are on the dietetics topic, so you talked about the demand being high for dietitians in Singapore. Could you maybe elaborate about this?
So actually, our faculty has worked closely with the dietitians, the local dietitians, chief dietitians in the hospitals as well, to understand and project what's the demand for that. For dietitians in the workforce in the subsequent years. So, but in terms of how the number of dietitians that is required in each hospital, it's not as many as compared to like perhaps physiotherapies or occupational therapies that is required in terms of the manpower. So we also often get questions about why the intake size for dietetics is much lower than other allied health programs. So this is also based on the manpower demands in the workforce as well, because we also don't want to flood the to have too many students, and then we then they end up not having sufficient employment placements after they graduate. So that's why the dietetics program intake is much smaller comparatively. But every year we will actually have close discussions with our industry partners. So that's why then the intake size, etc., will also be adjusted accordingly as well. Yeah.
Got it, Ashlyn. Another question, also dietetics. So, is the dietetics course globally recognized? Will I be able to further my studies overseas with a Masters of Dietetics with a foundation of the SIT Bachelor of Dietetics degree?
I will do my best to answer, but maybe Tim can also help to add on a bit more with your knowledge as well. If you would like to practice as a dietitian overseas, you will need to check with the accrediting body in that particular country. So from what I understand, currently in Singapore, dietitians are not included under the AHPC, but there is a SNDA that you can kind of register with to get is I don't think it's really an accreditation, but more of register with SNDA to know so that they have a list of dietitians who are practicing in Singapore. And if you would like to further your studies, then you would probably have to check with that particular university whether it is accepted or our program is accepted by them or not. So every master's program, I believe, will have their different entry requirements, and it depends on what is the specialization that you would like to pursue for your master's degree.
Thank you, Ashlyn. Okay, perhaps we go over to some interview questions first, then we go back to the SLT questions. So a question is, there's a question here which asks, how is the interview process like? And how many applications do you receive each year? How many are shortlisted?
Okay, so for the interview process, for the allied health programs, we adopt a multiple mini interview approach. But what would be different for applicants this year is compared to perhaps what you have heard from Celine and Shu Hui earlier, is that Celine and Shu Hui from the earlier intake, they would have attended the physical multiple mini interviews on site. But this year, for also due to the current safe distancing measures, etc., we have adopted an video assessment approach. So from the candidate's point of view, you will not have that a very how to say, like similar experience from your seniors, where they had to really go, they really entered each station one by one. But for candidates this year who are taking the interview, it will be a video assessment approach where you will attempt all the questions in one sitting, but it will be assessed separately by the different SIT faculty and industry partners. Yeah, so it's really to summarize, it's a video assessment approach this year. And then in terms of the number of applications we receive each year and how many are shortlisted, it differs from program to program. And the number of students shortlisted, aside from those who meet the academic requirements, we also have aptitude-based admission. So we also take into consideration if you have, let's say, a relevant work experience, perhaps as a therapy assistant, etc. So those are also taken into consideration as well in our shortlisting.
Thank you, Ashlyn. There's a question of what qualities do interviewers look for when applying to SIT? Do you want to elaborate on that, except for other than you have mentioned the working experience as a therapy assistant and that sort of thing? So what is the SIT student that you're looking at? What is the applicant profile?
Well, I mean, maybe I can answer this. From a faculty perspective, I'm also an interviewer in the past few years, and also in the selection panel. I think we are looking for students who really understand the profession well. And as their first choice, let's say we are looking at choosing occupational therapies as a first choice. We need to find out that whether students understand this profession well. All right, so must do study, research a little bit about this profession, and before you take the video interview. And secondly, I think we want students to have a good communication skills and also project themselves as a confident person and a rounded person. It's not just good in academic, but someone who actually knowing not just healthcare system, but also as a layman person, as a confident person, we want them to show their confidence in all areas. Yeah, I think in general, this is something that we are looking into. Definitely, there are specific questions that we change every year. So you may heard about something from other students, but we do change questions every year. So yeah, sometimes you won't be able to prepare exactly what we are going to ask you, but definitely you need to be confident enough to take on the challenge as a healthcare professional.
I may add as well, I think, you're going to be joining healthcare, which means, a lot of time you're dealing with patients, you're dealing with people who may not necessarily be in the right frame of mind. They may be angry because they are not feeling well. You may be dealing with family members who may think of alternative remedies for their patients as well. So I think it is also very important for you to be compassionate. You need to be able to stand on your ground, and also think on your feet as well. So sometimes all those questions that we are asking in the multiple mini interviews is really to put you on a spot so that you can think and then develop that mental frame of mind, to deal with that particular situation or scenario that we've given you as well. So I think these are all those kind of qualities as well that, apart from, meeting your having your grades and whatnot, I think most importantly, for you to join the healthcare sector, you need to understand that you'll be dealing with people. So if you're not people oriented, I mean, then this might not be a suitable profession. Yeah, I hope that kind of adds to the answer.
Thank you for sharing. I would like to share as well. So, like the panel mentioned, right, it's really about being in healthcare, being patient-centric. So one of the things we look out for in our MOHH scholarship interviews, so I think they will be the same, is how do you care for the patient? How do you make the patient the center of your care? And we put you on the spot really. For example, we have questions that ask you, for example, if you are a PT or OT, and supposedly the doctor's prescription or advice might conflict with your own understanding or might conflict with your assessment of your patient. What are you going to do then? Are you going to give in to the doctor? Are you going to find out more? Are you going to push for a patient-centric approach? So I guess we will evaluate all these sort of things and the sort of qualities that the panel rightly pointed out. So being able to think on your feet, being able to in the hospital, in a hospital setting, are you able to react to the hustle and bustle of the setting itself? So I think these are qualities which are common across the board. So to prepare for interview, these are good tips. So I think you can prepare along those lines. Okay, another question for the panel. So with an aging population in Singapore, why isn't there more places in the cohort for SIT allied health? Heard that SIT's allied health courses are always oversubscribed by a lot. There's another question which also asks us about the most in-demand allied health discipline. So maybe we can take those two questions together.
For the first question, it's the number of places, right? I think it's the number of places are not like purely decided by SIT itself. It's really about government's projection in terms of aging population, in terms of the community sectors as well. It's not just about hospital, but also community care sectors. Yeah. So we take the number and then of course, based on our SIT capacity, yeah, and then we evaluate. So this is what I actually gathered lah. Min and Ashley, if you want to add anything.
I think Ashley actually kind of answered that question earlier on as well. Like as we've already shared that, this is not a sole decision that's made by the institution, but it's usually determined by the Ministry of Health as well as our industry partners to make that projection of how many graduates do we need to to pump into the industry, right, to help meet that demand. So it's also a matter of whether sure enough, there's a demand for it, but we also want to ensure that there's proper infrastructure that's built in place before we bring in the software, which is where, SIT as well as MOHs come in to ensure that to happen as well. So this is actually a lot of calibration on the industry as well as the institution to ensure that.
Another thing that we also take into consideration is the clinical placement. That we may not have enough clinical placement slots if we take too large quantity of students. So this is another major considerations for SIT. I mean, yeah.
Yeah, so if I can also add on, I mean, aside from the projections and the close discussions with industry partners, so we also, for candidates who may be unsuccessful in their application, we do encourage you to, if you are really passionate in joining the program, while you're waiting for the next application period, do look for relevant work experience. We do have a number of students who were successful in their application after applying for a few times, and in between they actually gain the relevant work experience that not only helped improve their relative standing in their application, but it also helps them in their academics as well, because they will actually have a better understanding of the profession, and when they enter the program and they take the modules, because then it kind of gives them a better understanding, and they are more prepared, and they are more certain that this is the profession that they want to join, because after all, this is a 4-year program, and it's quite a large investment of both time and money into the program. So we do want, it will also be a good chance for you to be certain that this is the profession, especially for applicants who may be wondering whether if perhaps physiotherapy or occupational therapy will be more suitable for them. So if you are not sure, then some kind of job shadowing or work experience will help you to understand better before you commit to the 4-year program as well.
Thank you for sharing. I think from a broad-based level, we also at MOH Holdings, we do expect the demand for certain allied health professions to increase because of our aging population. So although we can't say for sure the exact amount, but one of the scholarships we have recently came up with was the community care scholarship. And I think that one, you can study physiotherapy, occupational therapy, speech therapy, and social work. So these are some of the disciplines that are actually probably going to be in demand because of aging population. They need help with physiotherapy, occupational therapy. If you have a stroke, for example, you'll need help with swallowing, that kind of stuff. So do check this out. And I think SIT's speech and language therapy is also new. So that tells you a bit about the demand and where the industry is going towards. Okay, so let me go back to SLT. So speech and language therapy. Is it a competitive course? I think the answer will be number of places. But okay, so I'll read out some of the questions, then Ashlyn or maybe Min, you can see how you want to answer. So the first one is SLT a competitive course? The second one is, how does SLT cost compare to those of overseas universities? One more is SIT's SLT degree is not currently internationally recognized and accredited. Will I still be able to pursue a master's abroad? So these 3 questions.
Okay, maybe I'll just start off first, then Min can add on. So for SLT, I will say that it is also a rather competitive program because of the lower intake size. So for AY 2020, we have about 29 speech and language therapy students for our first cohort. So that will give you a sensing of the competitiveness in terms of the available places. For SLT, there is also a rather high is a higher requirement in terms of language. So aside from the English language requirement, SLT program also requires students to have a mandatory second language requirement as well. So it will be in a way more competitive in that sense that you have, aside from English, you still have to fulfill a second language requirement to be eligible for the program. Regarding whether if SLT degree can pursue a master's abroad, like I mentioned earlier, similar to dietetics, it will depends on whether if you would whether the university accepts our degree. But to practice as a speech therapist in Singapore, SIT's degree, graduating from our degree you will be eligible to register with AHPC to be a speech therapist to practice in Singapore. So we are also, the program as it is new, so we will be seeking accreditation from AHPC as well. So this is kind of a work in progress because we just started. Yeah. And
okay. The other question, I think, that compares with overseas universities.
Okay, so for how SLT course compare to that of overseas universities, I'm not able to speak for the programs from overseas universities, but what I can share is that when we were designing the speech and language therapy program, we work closely with the speech and language therapists in the hospitals, with our industry partners as well, in terms of the curriculum. But we also understand from our industry partners that there is, because of the aging population, we will actually need speech therapists who are bilingual, so that they can communicate better with the local the patients that we meet in the local context. Yeah, so if you were to pursue a speech therapy course overseas, what you might be missing from in the overseas program will be that our programs are really more catered towards the Singapore aging population, which this will be something that you may not encounter if you are pursuing an overseas speech therapy program. Tim, do you have anything to add on?
Let me add on. I think I shared this just now during the Q&A for the other programs. The two key components that make our SIT degree programs stand strong is that we have the localized elements that the industry partners actually came in to teach our students, and also we have the clinical placements that is in the local hospitals and the healthcare settings that actually make our students understand the healthcare systems, community care systems much better upon graduation, because we are actually producing students for our local healthcare and community care sectors. And that's our primary objective. That is why SIT degree programs is for local students. And then you will notice that we hardly have overseas applicants, because SIT HSS cluster is at this stage, we are still primarily focusing on local graduates. Yeah.
Thank you, Prof. and Min and Ashlyn for sharing. Yeah, I think those explanations are really, really good. So some background, the MOH team, I think we met with the speech therapist professors somewhere last year to film a video. So we met Desiree and I think Valerie. So the key thing about the speech therapy program in Singapore is that it's designed for local context. So I guess when you put the culture into perspective, when you put the languages, the slangs, the connotations, if you're going to study at SIT, I think you would be ready, almost ready after you graduate to go into the workforce. But I guess if you're overseas, it's going to be very different because of the way they speak, the way they communicate. For example, right, I think the way my daughter calls me is going to be very different from overseas. So overseas, I think they will call it in, maybe if you're in Australia, a very Ang Moh slang sort of way. But for here, it's very simple. It's like papa, mama. So those are the sort of difference I think you can expect. And I think why SIT is positioned very strongly to conduct the allied health programs for the Singaporean cohort. Okay, moving on. So some questions on interviews. So will interviewers touch on content-based questions like science questions for health science courses, or the questions usually generic and tell me about yourself type of stuff?
Well, I think here we are trying not like to reveal too much like details about the multi-minute interviews. As I mentioned, we want students to get yourself prepared and to be confident and also knowing the profession. These are the two key components that we are looking at. And also, I think as various speakers shared, we want students to be caring with a caring heart and when you apply for the specific programs, and also be resilient, okay, and in order to handle all kind of challenges. In terms of what exactly going to be asked, it really depends what kind of questions that actually came out by the admission committee, because we do have our admission committee from our cluster to look into specific questions each year. So yeah, so don't be too stressed about what be prepared. I think, as I said, understanding the program that you are going to apply for, it's more important than, do I have to know a specific content-related questions in science or in anatomy, all that, okay? So I already give you some hints.
Yeah, so maybe just to give a bit of assurance, some kind of questions that unlikely to come out from in the MMI would be, maybe we will show you a diagram of the heart and ask you to identify certain parts, you know, that Professor Tariq had mentioned earlier. So we also understand that our applicants, some, because we have applicants from diverse backgrounds, some could be polytechnic graduates who are from a science-related program, or maybe non-science related programs, and also A-level students who, even though they have taken subjects such as biology, etc., but they are not in a way trained in terms of the health sciences side of things. So these kind of questions, the kind of questions that will come out is really for the interviewers to assess your suitability and the other traits that we have mentioned earlier. Yeah.
Thank you, panel, for sharing. To add on, I think a lot of primary and secondary information available online and everywhere. I think the healthcare sector is now currently in the spotlight. So you can go to SIT website, you can go to Care to Go Beyond website. I think you can find lots of info there for your prepping. Okay, another question. So there are a lot of questions on grades and ranking. So maybe Ashley or Min, can you elaborate like on, you know, for JC and Polys, what is like the cutoff grade sort of thing that you're looking at?
I think it might be good to, as I've earlier shared in my presentation, that we have actually published our indicative grade profile to just give you a gauge on, you know, what sort of academic standing our students have gotten in terms of percentage-wise in last year. So that gives you a gauge. But that said, I don't want to just kind of stress to say that, oh, as long as you are a straight A student, it means that you get a higher chance of getting into the course that you want to. So we have kind of maybe shared many times that that's just really to ensure that you come in, you know, you can cope with the academia of your studies, right? But there are also many aspects that we are looking for, and particularly when you're joining a healthcare sector, it's really the other attributes that will come into play. So if you're looking at, you know, what's the minimum cutoff and whatnot, refer to the indicative grade profile as I've shared previously. Alternatively, I think you can go onto our website and the information is there just to really have a sense check of, you know, what sort of gradings they have. And you will, I also like I've mentioned, just to reiterate that it's not just that. Yeah, we really look into other aspects. And in fact, when our students are shortlisted and they all come for the multiple mini interviews, actually everyone is just going to be reviewed on that same slate. Yeah, it's no longer a matter of, okay, if my A levels is all straight A's, your chances is higher than someone who has gotten ABC, for example. Everyone is going to go through the same interview, and everyone is just going to be treated equally, and then we are all going to assess you based on that new standing. I hope that answers that question. Actually, you want to add on to my answer?
Yeah, so maybe just to add on to what Min shared earlier, like after you have been shortlisted and entered the multiple mini interview stage, I think some common questions that we get is also, do we give, like, let's say poly or A-level students a higher priority, etc. So this once you have entered the interview stage, everyone is on a fair level playing field. So there's no, the interviewers will not know whether if you are from a poly background or you are from a A-level background, etc. So it's really just the grades wise is really just to make sure that you are able to cope with the academic rigor. So yeah, like me mentioned, you may use the indicative grade profile as a reference, but really focus more on, I think at this application stage, for most of the applicants, the grades is something that is kind of like fixed, more or less fixed already. I think it's more important for you to focus on preparing for the multiple mini interview and do more research in terms of the profession that you wish to join. I will feel that personally, I will feel that is more important lah.
Thank you, Ashlyn. So another question, and I've posted the indicative grade profile in the chat, so you guys can go and have a look. So I think before I go to the question, same thing for MOH holding scholarships as well. I think it really depends on the applications for that cohort as well. So from there we can shortlist and that sort of thing. So if you're going to have all the straight A students applying to a certain program or scholarship, then it will definitely be more competitive. So I think the indicative grade profile should give you a sense of that also. So question by a full-time professional in the HR industry who would like to do a career switch, pursuing a part-time therapy services course and very keen on OT. How will I be able to enter as compared to those with prior science background?
We have a lot of similar applicants like that from a non-science stream. My recommendation is, if you do have a similar relevant background in healthcare industry, like in that case, just apply. Okay, just apply. Yeah, then we'll leave it to the panel to decide whether you are suitable. All right, if you're shortlisted and come for MMI, yeah.
Thank you, Prof. I think, side note, right, I think that also the fact that they have such programs going on is also a testament to the demand of the healthcare courses in Singapore. I think we're really ramping up quite a lot due to the pandemic and the aging population. So, okay, let me take another question. Maybe quick question. So, will MMI be conducted online due to COVID?
Yes, it's a online video assessment. So applicants will not need to come down on site for the multiple mini interview.
Another one, are the interviews conducted in group or individually? If sensitive, you don't need to share.
Yeah, video assessments are individual because so for the video assessments, maybe what I can share is that you will, if you are shortlisted, the video assessments is something that you don't have to it's different from like the physical interviews where you are given a specific time slot. Let's say, for example, from 9 a.m. to 10 a.m. and then you have to come down and attend the interview during that particular specific time period. So it's a bit more flexible, especially for, let's say, applicants who might be currently pursuing a full-time job, or applicants who are currently serving their national service. So you do have a bit of flexibility in that sense, where you know, you don't have to, you are not given a specific date and time to complete the interview. Yeah, so it's all, you can do it, you know, perhaps for some applicants who will find it a bit more conducive to do it perhaps in the middle of the night where it's quieter, or perhaps in the morning, etc. So it's a bit more flexible and convenient for applicants to complete the video assessments in that sense. Yeah.
Thank you, Ashlyn. So I will answer a few more last questions. So will I be vaccinated? I think that's a yes. I think if you read the news yesterday or the day before, I think everyone in Singapore will be vaccinated over the next few months. So, and I think healthcare students do get vaccinated. So that's no issue. Okay, maybe one last question for the folks at SIT. So there are some questions regarding the 3D model being online. Are there any more such lessons going to be played? Maybe you want to share if you have any sessions coming up in the next few days or weeks?
Tim, you want to share the sorry, not MOH, the Health and Social Sciences Discovery Day? We are going to be running a HSS Discovery, Virtual Discovery Day next Saturday, or this coming Saturday on the 27th of February. I'm so sorry, I don't have the information here.
I think
but
we have already closed registration.
Oh, okay.
yeah. I think we need to prepare ourselves.
Okay, so sorry
if
about
you
it.
have not registered, I don't know whether we can still
Oh, we can, yeah, I can just write into us actually.
let me flash the slides where let me find the slides.
Yeah, and write in. I think
I think probably the link is no longer active, so sorry. Yeah.
No, but
we
just
have a deadline for
the
registration.
just the email that they can write in to see whether we can still slot them in. I think that would be good. That would be great.
Let me check.
Yeah. Okay.
Yeah, let me share my screen.
So
okay.
Yeah. So
Prof, you don't need to share the screen. We will put it in the chat.
So I think Nigel has helped to share the email address. Do write into us, and we'll try as best as we can, you know, to slot you into our event that's happening this coming Saturday morning from 9:30 to 11 a.m.
Okay, got it. We have posted it in the chat. So that's it. We have come to the end of our session. So thank you, professors and the admission officers, for taking the time to answer the questions. To the participants, if you have enjoyed this session, please take a few seconds to rate this program at the bottom left of the screen. Our next session is Walking in the Healthcare Professional Shoes, which is conducted by our very own scholars, coming up at 2:30. So it's a session which puts you in the shoes of a healthcare professional. Do join us later and have a great lunch. See you at 2:30 p.m.
All the best for your application.
Thank you, Prof. Bye-bye.
Thank you, Nigel.
Thank you.